Topic today. So we're going to switch to the knowledge burst, and our topic today is what about the future? And Katie and I will give you some just big picture information to think about. There's a lot of details we could go into, but we're trying to set kind of the overall stage for you. So next slide. So for disclosures, I've worked with some pharmaceutical companies. I've provided legal consultation for some cases, and Dr. Burke doesn't have any specific disclosures. None of those are relevant for today. So when people get the first diagnosis of autism, the most common questions they want an answer to right away is, where is my child on the spectrum, and what will their future be like? And that's completely understandable and natural for that to be the first questions that come to mind. And parents want to know, what is the future going to hold? Is my child going to live on their own? Are they going to do things that other adults do, like maybe go to college or have a specific job? Are they going to get married? Are they going to have children? Those kind of things. And most of the time, especially if your child was very young when they were diagnosed, the most common answers you probably heard from your very excellent provider and very well-meaning provider is, we don't know. Or they might have said something like, we really don't have a crystal ball to see into the future. And that is true, but as your child develops, there are some things that we can maybe help you think about regardless of what the future is going to be, to help you kind of manage the future. So next question, or next slide. Okay, so just taking a step back in terms of parenting in general. So when you're a parent, your child comes to you and your child is on a path, whether they have autism or another developmental disability or no disability at all, your child is on a path, but we just can't see it all the time. We can't see it yet. And we also can't always control it. And it's helpful, I think, to remember that even though the first question when you get a diagnosis of autism is, is my child going to live independently? Is my child going to get married? You actually can't guarantee that any of your kids are going to do those things, right? We have very little actual control over some of these things. Even if you have a lot of things going for you, it's usually not really up to you fully whether you get married or have kids. We have very little control over those things. Other people have to be involved in that process. So we can't guarantee that any of our kids are gonna do things. So just kind of keep that in mind. And also keep in mind that when you have kids, the gift of being a parent, what you get back for being a parent is that you get to witness your child grow. You get to witness what happens to them over time and witness their development. That's really the gift. We don't have control over our kids. We don't have control over their future. We can parent them, we can teach them, and we can support them, absolutely, but we don't have 100% control. They're on a path. We can't see it yet. We get to watch. We're going to try to help along the way, and it's going to be an adventure. Okay, next slide. So most parents, when they have a little baby, they are going to think something like, my kid is going to be the most amazing kid in the whole world. My kid is going to be an astronaut or president of the United States, or they're going to play in the NFL or the NBA, and or they're going to be an astronaut. Most parents have completely ridiculous expectations for what their child is going to do. I know I do. Every parent does. So what we want to sort of remind people is that we want you to keep those ridiculous, unrealistic expectations for your child, and also take their diagnosis seriously. So here are some very famous, very accomplished people that you might recognize, and they all have some kind of neurodevelopmental disability. So next slide. So Greta Thunberg has autism, so does Danny Bowman. Simone Biles is pretty open about her ADHD. Clay Marzo has autism. Whoopi Goldberg has dyslexia. RJ Mitt has cerebral palsy. And Dan Aykroyd and Vernon Smith have both been vocal about their autism. So there are a lot of very accomplished people who have done tremendous things and taken their diagnosis seriously and worked with their strengths and their challenges. All right, next slide. That doesn't mean that that the expectation is that your kid needs to be Simone Biles, but it's just the idea that there are a lot of very accomplished people who have done amazing things. And there are also a lot of very successful, not famous people who have done great things and have had diagnoses of a variety of things. So not everyone who is famous has a diagnosis. Not everyone who's not famous doesn't have a diagnosis. Okay, so for good parenting, what we want you to kind of keep in mind is we want you to have really high expectations for your kid. If all your kids are doing chores around the house, we want your kid with autism to be doing chores. If all your kids are managing their homework by first or second grade, we want your kid with autism to do the same thing. If you expect all your kids to try hard and work and help other people, we want those same expectations for your kid with autism. And we want you to take your diagnosis seriously, take your child's diagnosis seriously. When you can balance those two things, we find that parents really have the best, kids have the best outcome and families have the best outcome. So while you're having this high expectations, you're gonna learn strategies that can help your child. You're gonna provide a lot of support, a lot of warmth, a lot of encouragement, while you're also providing high expectations. When you can eliminate stigma in your circle of influence, you are taking your child's diagnosis seriously and providing high levels of support. So if you have family members who don't think that people with ADHD or people with autism have a real condition or don't really have struggles, or you shouldn't talk about disability, anything that sort of smacks of some sort of stigma, if you can work to eliminate that in your own circle of influence, then you have done something good for your child and other children also. And when you are using all the tools available to you, then you are taking your diagnosis seriously. So if you are using disability accommodations that are available to you, when you are using your IEP and the other services that are available, when you are using medication when it's available, you are taking your diagnosis seriously and providing the support that your child can benefit from. All the tools, not just some of them. Okay, so as a parent, what's in your future when you have a child with a diagnosis of autism? This is the idea behind this slide is just to sort of orient you to, and you probably have figured this out, but just to orient or confirm that when you have a child with a chronic health condition or a developmental disability, there are some things that are in your future. You are going to be managing a lot of documents. You are going to be going to extra therapy and meetings. We did a study and found that for the average family after an autism diagnosis, they were averaging some sort of doctor visit about every week, whereas families that didn't have an autism diagnosis were averaging an unusual doctor appointment every few months. Okay, so that is going to be like a part of your life. There's going to be some kind of appointment that happens about once a week, and that's a thing you have to manage in your schedule, right? You're going to be part of a new community. There's a saying that especially if you have, there's a saying among rare diseases that it's when you get to join a community of families who are going through the same thing you have, it's like the nicest group of people you never wanted to meet. So you're gonna meet a bunch of wonderful people that are going to be a new community. But that's a thing, that's a group that you have to manage and figure out how to be a part of that. And then you're also going to have a lot of people telling you what to do and telling you that you should try this, you should do this, you should learn this skill, and you're going to be overwhelmed with advice, but from people who know what they're talking about, but also from people who don't know what they're talking about. And managing that is also a kind of a thing that's in your future. So some of the ways you can practice some self-care, I think, as a parent getting ready for this journey or being on this journey, is to think big picture. Figure out that you need a file spot for all these documents. Don't imagine a world where you're just going to be able to find it in an email, or it's going to be, you're going to remember where you put it on the counter. Get a box. It doesn't even have to be fancy. Get a box, get a file, get a folder on your computer where you put everything so that when you need it, you can find it. Documents end up being such a barrier to getting eligibility for services and filling out these other forms. It can be really overwhelming. So having those papers in one place is great. If you're not a big organizer, just put them in the box. You'll be able to rifle through and find them. Recognize that you're going to need some extra time. You're going to extra appointments. So you're going to need some extra time. How are you going to manage that? What are you going to, how are you going to get some help from the rest of the family to make time for that, or to acknowledge that this is just a thing that happens and not be surprised and not be overwhelmed every time it happens. And then also keep an open mind. You're going to get lots of advice. You're going to get advice that you think you've already addressed. Some therapist at some point is going to say, have you tried this strategy? And you're going to say, yeah, I did that. It didn't work. Keep an open mind that things might be different now and it might work this time. You might not have done it exactly right. You're in a different spot. Your kid's in a different spot. Maybe you have a better coach now in this therapist, and you could try something that you think you tried before, you have tried before and didn't work. Keep an open mind. It might work if you give it a new opportunity. And then big picture also, your own health is really important. And so when people talk about how to manage difficult situations, they usually think about making sure you're having healthy food, you're getting enough sleep, and you're getting enough exercise. And it's putting you in the best spot that you can be so you can really help your child and do it well. Okay, next slide. And keeping in mind that there are a lot of supports that are probably going to come into your life at some point and could be in your future. This isn't really even all of them. This was just a list that would fit on the slide. So when you have a child with a chronic condition, here are some of the things that could be involved to help you. So the idea here is that just to know there's a long list. It can be super helpful. It can also be a little bit overwhelming. But that's why you're going to have a file. You're going to just understand this is part of the deal. You are going to earn every dollar of government assistance you get, because you will have filled out so many forms in so many obnoxious ways that you will have completely earned it. So don't ever feel guilty about getting any assistance. It's part of what society thinks is important to do. We don't support special needs and vulnerable people enough in our society. So please take advantage of any social support that's available to you, that you're eligible for in any way. Okay, next slide. All right, Katie's going to take over now.
Great. Thanks for that great information, Judy. Okay, so I am here to talk for about 10 minutes or so about self-determination and how it's going to relate to your experiences as family members of youth with autism. So my first question, and you can put this in the chat, is what words or phrases come to mind when you think about what self-determination is? And if you don't know, that's okay. This is just getting the ideas out there. Okay, so we think about possibly independence, motivation, great, being heard and respected for things you want as your own person, drive, doing what you love, wonderful. All right, well, can we go ahead and click that slide so we can have a definition come up here? When we talk about the general definition of self-determination, what we mean is it means acting or causing things to happen as you set and work toward goals in your life. So that relates to a lot of things that you all mentioned here, because there is an element of motivation, of vision, of autonomy that's going to come into play. And so we'll talk about why that's so important within transition in particular, when we're talking about a student transition from schooling to post-secondary life, as well as what you can do as family members to promote that. So next slide, please. Okay, so why is self-determination important when we're talking about students and that youth age range? Well, we know that when students leave high school with greater self-determination, we know that while students are in high school, when they have greater self-determination, they experience and achieve greater academic outcomes. That's things like progress in the general education curriculum. That's things like academic goal attainment. So doing well when it comes to content. What we also know is that when self-determination is promoted while students are in high school, they experience increased post-secondary outcomes. So that's things like enrollment and successful completion of post-secondary education. So college, university, two-year programs, career and vocational education, employment. So thinking about that goal of competitive integrated employment, work alongside people with and without disabilities for fair wages, and community participation. We also have links to quality of life, and I won't go into it any further here, but suffice to say that this can have a really meaningful impact on a person's life. Next slide, please. Great. So here's a list of skills and abilities that have been evaluated through research to be associated with self-determination. So being that person who makes or causes things to happen in your life. These are choice-making, decision-making, problem-solving, goal-setting and attainment, self-management, self-advocacy, self-awareness, and self-knowledge. So if we click the slide here, my question for you all is how many of you or your children would benefit from support in one or more of these areas? Feel free to throw things into the chat. What can you think of in your own life or your child's life that would make these skills highly relevant and potentially areas to address? Amy says, me, all of, oh, sorry, me, all of them. Great. I think the self-management piece in particular is something we can all relate as being an ongoing journey into adulthood. Somebody else said all of these areas, great. I know goal setting and attainment is something I continue to use frequently, whether it's my professional goals or my personal fitness goals. Those are all things I'm working toward. We have also seen that students will have varied strengths and areas for improvement with each of these skills. And those are things that we can concretely address while students are in school and while they're out of it. So on the next slide, we're actually going to talk a bit more about how you can support the promotion of self-determination now and as students get a little bit older. So if we click this slide once, you're going to see the list of things that you can do when a student is in their, or a child is in their earlier years. So think ages 3 to 13. A few ideas are that you can encourage opportunities for choice making, problem solving, and self-management in daily activities. I think too often, whether it's as a family member or an educator or a healthcare professional, we want to make things easier for the people that we're supporting, right? That's all of our inclination, to see them feel happy, comfortable, successful. But it's those opportunities to be a little bit uncomfortable within a safe environment to fail that really allow each of us and those we love to grow. So finding those ways that somebody can make a choice, maybe it's not the perfect choice, but they're going to learn more from having made that choice on their own and then having had to course correct than they would if we're always making the safest or easiest or best choice for them. Something else to do when it comes to education is that if your child is receiving special education services from an early age, supporting your child's active involvement in their individualized education program, IEP process. The same would be said if it's a student who has a Section 504 plan. What I'll note here is that different schools, different educators have kind of varied approaches levels of doing this, I would say. So sometimes it is going to fall on the family to say, hey, you know, if this IEP is about Daniel, we want Daniel there at that meeting. What part do you think might be best for him? Of course, maybe he's not going to be there for the beginning conversation where you're going over all the paperwork because he's 8, but that section where you're talking about what are the most important goals for Daniel to focus on for this coming year, that's a perfectly appropriate time for a student of almost any age to be present in the IEP meeting. And I'll talk in a minute about how you can continue to support that as a student ages. And so then lastly, modeling using skills associated with self-determination in daily life. Point out things that you're doing, point out choices that you're making and how they affect you, point out choices you see your child having the opportunity to make. Similarly, point out when your self-management has maybe fallen a little short. We all have those examples of times we press the snooze button one too many times and we're late for something. Well, maybe that's because we didn't get ourselves to bed on time, right? And so it had that consequence of us being late for something important to us. So that's what you can do during the earlier years. If we click this slide one more time, some things that you can do as a student reaches what we know as the transition age in Pennsylvania. A student receiving special education services will have a transition plan section of their IEP developed from the year in which they will turn 14 through their duration in school. So it's really at this age range that we start getting a lot more concrete with action steps towards the future. One of them would be things like discussing your child's goals for their future with them, and then supporting them to take steps. So this relates to the case study we saw, right? That would be a great time with that student to begin talking about how do they want to spend their days? What do they see as most important? What do they enjoy doing? What environments do they like being in? Next, and again, this relates to that idea of sometimes being the advocate to push the school a bit. Talk with your child's educational teams about what they're doing to promote self-determination. You can cite these slides and say, listen, I know the research. I know how much this matters for post-school outcomes. How can we target this in school? There are plenty of freely available curricula and materials out there. There are also things that they can pay and get trained on, even better often. But there are certainly things available. So don't be afraid to ask those questions and have that conversation. And then lastly, and I think this is probably the hardest thing on here to do, allow opportunities for self-advocacy by stepping back, right? Letting your child take a chance to step up and say what it is that matters to them, what it is that they need, what it is that they want. That's both during important meetings like an IEP meeting or a meeting with a potential service provider, but as well as when making more and more decisions throughout their daily life. Again, when we have a safe opportunity to fail, it's okay to make the wrong decision because your child knows that you're still going to have their back. You're going to figure it out together if it doesn't go well, but they're going to be better off for having worked toward that on their own. So that's a fast and furious guide to self-determination. And now we have time for some questions.